I am Dr. David Bell, Professor of Pediatrics and Population and Family Health at Columbia University Irving Medical Center in New York City, and President of the Society of Adolescent Health and Medicine. I am honored to provide the opening remarks to the HPV Roundtable event today. As the President of the Society of Adolescent Health and Medicine, I want to declare from my mountaintop that the health of our adolescents matters greatly. In short, a healthy, healthier adolescent population can forecast a healthier adult population. We have made great strides in our population health overall through prevention, particularly through the use of vaccines. In the context of the HPV vaccine, it means a future adult population free of a set of cancers. What a truly unbelievable year we have all experienced. Although the story of the pandemic has yet to be finished, our lives and the lives of our adolescents and young adults were disrupted in so many ways, including healthcare services. For sure, the pandemic accelerated changes in healthcare delivery through the urgent and widespread integration of and reimbursement of telehealth services. Telehealth now offers the potential for increased access to healthcare services. However, during the pandemic, routine adolescent visits suffered, and as a result, vaccine delivery suffered, except for those in their early years of life. 2020 also highlighted many disparities with healthcare access, only being one of many. Two of the articles that were suggested readings discussed racial and ethnic disparities related to HPV vaccination. One article by Spencer, Kalo, and Brewer had a brilliant discussion on the probable drivers of vaccination patterns. The understanding and synthesis of the literature to date by the authors is that the vaccination patterns are likely a result of systematic differences in care and unlikely related to patient preferences. Location of care, that is, care from safety net providers versus private offices, possibly plays a significant role. Provider level factors, including implicit bias and communication around the vaccine, also are probable contributing factors. The implicit bias in communication by providers was highlighted also in the article by Vu et al. When understanding the HPV vaccine delivery among the diversity within the Asian American population in the US. To further discuss adolescent vaccination, I would like to transition to today's featured presentation showcasing the dual rocket boosters of adolescent vaccination. Speaking from the public health perspective, I'm pleased to introduce Dr. Melinda Wharton, Director of CDC's Immunization Services Division. Dr. Wharton has served at the CDC for over 35 years in a variety of leadership roles. She'll be providing us with context on the pandemic's impacts on childhood immunization with specific requests for action from stakeholders. Dr. Wharton will be followed by Dr. Stanley Spinner, the Chief Medical Officer and Vice President of Texas Children's Pediatrics. Dr. Spinner will speak from the perspective of the private sector and share lessons from his health system as they adapted HPV vaccination practices to the challenges of COVID-19. After their respective remarks, we'll have a group conversation and take audience questions in the question and answer box. With that, welcome Dr. Wharton.